Hi there guys, and welcome to today's live stream at 1 p.m. We've moved it forwards an hour for you, and today we're going to be discussing how you can stretch your hamstrings if you've got lower back pain, or a safe and easy way to do it. I'm going to cover a few examples of how not to do it, how you can do it, how you can do it on the floor, and how you can do it even better. So I'll go through all of those. And the reason we've taken the time to go through these hamstrings in particular is going through social media over the last couple of days to a week. We found there's a lot of stuff on the hamstrings and those sorts of things, those stretches, and there's a few flaws in some of the ways people are doing them that if you've got back pain, they might be a little bit problematic for you. So not to say if you're a perfectly healthy individual, these are fine, most of them are going to be fine, but there's just a way that we could do it that might be a little bit better for you if you've got a history of any back trouble or have it currently, so you can be more effective with your stretching. So if you're new to the live stream, then we're doing these every weekday. That includes tomorrow as well, and on Monday this weekend. So we'll go through the live stream and just kind of cover some topics that hopefully are going to be really helpful to you guys. And if you do find it helpful or have any questions, you can post those in the comment section as you're watching this. So Lara, who's behind the computer and cameras here, will be able to read them out at the end of the sort of the main bulk of the episode for the day. So do post those in the comments and we'll do our best to answer all of them on every live stream. So first and foremost, I thought we'd cover the role of the hamstrings today, first and foremost, and why they are relevant when it comes to back pain. So if you understand their role, you'll then understand the subsequent bits that we'll go through on the screen later. So first and foremost, we've got the spine here again. As of yesterday, this has been a new guest. So hopefully this will just help you appreciate that a little bit more and understand what I'm talking about in these live streams. So first of all, the hamstrings generally plug in down here. And one of the main things they do is they tuck you backwards like this. Now they do stuff in the legs and we don't need to talk about that today, but they tuck things under like so. And as we do this, it reduces and eliminates the natural curve in your lower back. Now we've got sort of the smaller of the backs down here. Your waistband will normally sit here. These are those two bony bits at the base of your spine, or where the dimples are in your lower back. So that kind of orientates you around where you are in your body. And those hamstrings pulling back this way can be problematic if we've got any sort of lower lumbar problems that involve the discs. And the reality is, with any injury in the lower back, you can't really injure one small structure without another, because all of these individual structures around here, the muscles, the ligaments, the tendons, the joints, the discs, etc., they all pre-stress one another. So it's very, very difficult to actually isolate one structure and injure it. Although from a diagnostic point of view, we'll regularly diagnose this is the issue, or here's a disc bulge, or here's a facet strain, or here's this and that. The reality of the way in which our body works is it's so interconnected, it's impossible really to injure one structure or one microscopic structure without having involvement from other tissues. So when we're talking about the lower back, a reduction of this curve is going to lead to more compression through the lumbar spine. And if we injure any of these segments down here, the 4-5 or the 5S1, those segments control the hamstrings, particularly the 5S1, control the hamstrings down here. And that can lead to issues because you can get muscle tension, you can get soreness, you can get spasm, you can get pain, all sorts of symptoms. But the fact of the matter is that if those hamstrings go into spasm to try and protect an injury down here, they actually can make it worse by putting more pressure through those lower lumbar discs in particular as a result of that spastic contraction. So it's important to stretch them. And you'll see this from time and time again. People say stretch hamstrings for back pain, but it needs to be done sensibly. Now, there are some caveats to this. We see patients in the clinic where we go into a lot more detail understanding the unique alignment or misalignment of that person's individual spine and how it may or may not be influencing the problem. And there are instances where overtly stretching the hamstrings may not necessarily be the best, but those are sort of the more severe cases where there's something else going on. For the average person watching this video who's got a little bit of lower back discomfort, or maybe you don't have any right now, then this is what I'm talking through here is perfectly applicable to you. So we want to stretch these hamstrings, and one of the main mistakes that people make when they try and stretch the hamstrings is they actually just stretch everything. It's not specific. Whereas if we focus movement to this hip joint here and just move that hip into flexion, what that does is that stretches the hamstring, and the stretch finishes here. It doesn't get the chance to translate into the lower back if we're doing it correctly. If we're doing it incorrectly, we just round everything and pull as much as possible, and that is where the problem lies. So the first video or first photograph. This is one we took earlier. It's a picture of me doing the hamstring stretch really, really badly. Now there are various variations of this. It's going to be you sat on the floor in sort of a V-sit position with one knee bent and stretching out to the other. But the main thing that we notice here on these examples is that the lower back is vulnerable. There's a bit of bending and twisting, which is something that the lower back and particularly the discs really don't like. It's not specific to the hamstrings. It's stretching everything from the back of your thorax all the way through to the plantar fascia in your feet, and it's just pulling anything, and that can create issues. If we've got vulnerability in certain areas along that chain, it can create issues by stretching this way. So it's just not specific. And we see you can do this leaning forwards to touch your toes standing up. Not very good. You can do it like lean on a chair, or you can do these sat down. Now the reason they're wrong is, as I've mentioned, they just put way too much load through that lumbar spine, and if there's a problem coming from the lower back and we want to stretch the hamstrings, we want to do it in a way that doesn't involve the lumbar spine and keeps the lumbar spine in the best possible position. And that best possible position is going to be a nice neutral position like so. So if we cycle over to actually look at, okay, how can we do this stretch better? What we want to do is, like I said, keep this spine in a neutral position and focus on getting the hip to move into a position of extension, and that moves this attachment site away from the attachment site in the lower in the back of the knee down here, and gets a stretch through the muscle. And when you're doing this, we want to have a slight bend in the knee, because that slight bend takes the pressure off. You shouldn't be feeling a hamstring stretch in the back of your knee. If you're doing that, your leg's a little bit too straight, you bend it slightly. And sometimes people say, oh, well, this is for me, I'm already flexible, I'm flexible. I've had people that come in that are the yoga instructors that are super, super flexible in everywhere. And when they make this small change and stretch correctly, by changing the mechanics of movement, rather than just one whole fold over, they focus it to the actual hip joint itself and stretch the hamstring with a slight bend in the knee. They can all of a sudden feel it in the right place and in the belly of that hamstring. And that applies as, for that person in particular, I'm thinking of a very, very flexible lady, all the way through to the guy who's stiff as a plank and can't touch his knees. So we need to get the stretches, we need to do it effectively, and just try it this way, or these ways that I'm going to cover now, because they do really work if you do them correctly. So this is exactly the same stretch, but just set up slightly differently. The main things that you're going to notice in here, that the spine is being protected. Now, sometimes this isn't necessarily the easiest stretch to do because you are weight bearing, and if your back pain is bothering you a little bit more, then you might find this position actually a little bit uncomfortable, because it does involve a slight forward tilt of the body. So having that chair there as a support can work better. And the main thing you want to focus on when you're doing this stretch is the bum pulling backwards. It's essentially, we're starting this position and the bum is just going backwards like that. That's all that's happening there, and that support from the chair in the example on the one side will just help take a little bit of load off your back and maybe make the stretch a little bit easier. It is important to notice that you're going to feel a little bit of tension in the lower back as it holds and resists, because you've got your lumbar erector spinae muscles which are going to resist the tendency for that to want to happen. So there will be a little bit of tension in the lower back as it's just resisting and holding everything stable, because you can't work one muscle without working others at the same time. So this just helps make the stretch more isolated by engaging some of the other muscles in the lower back. So don't be alarmed if you do notice that. Now, you notice that the foot is slightly tilted up. That's not an important point for this exercise. You might find that it's better with it up or with it down, but don't get too caught up with that particular part of it. And you notice in the example where I'm leaning on the chair, it's the right leg that's being stretched. We bend the left knee just so it makes it more easy for you to just move that bum back. You're a bit more balanced. If your legs stood bolt straight, then it makes it quite difficult to do the stretch more effectively, because you're just not balanced and braced. So bending that non-stretched leg is actually a helpful way to just make the stretch more effective. We're keeping the core engaged through here as well. So we want to have a nice support for the core so that it's able to protect the spine as well, and really helps you. If we hold the core, the lumbar spine, the back in general, nice and stable with the muscle, passive muscle, active muscle engagement, then we can focus the stretch to that hamstring so that most of the stretch actually goes through the hamstring rather than anything else. So those are really, really important principles. And you can substitute the chair for a wall or a chair for a surface. Simply put your hands up against the wall if you want to do it that way. Different people, different patients find different variations of these stretches very easy. The other one that we've got, you'll see on our YouTube or in the membership site, is sat on a chair, All of these are essentially doing exactly the same thing, and it's just about getting the movement is the same in all of them. The two that I've just mentioned, sat on a chair, leaning against a wall, standing, leaning on a chair. It's just the nuanced differences might be what works for you. Maybe you can do the sat on the chair well, but other people find it difficult to get the movement pattern right on the chair, so they may do it leaning on the chair rather than sat on it. And that's okay, effective, but make sure you're not making those mistakes that we made or that we saw in the very first one with the bending and twisting. Because that bending and twisting grinds those discs, it puts a lot of pressure through the spine and is no more effective in any way, shape or form at stretching the hamstrings. It's just a lazy way of stretching. And even if you take this stretching approach to other muscles, whether it's the quads, whether it's the hip flexors, whether it's the glutes, focusing on a more targeted stretch to the muscles that you're trying to work will be really, really helpful and make it much, much more effective with much less irritation as a result in other areas that you're not trying to influence. So then we go on to the last one. This is a really good one for people that maybe you actually can't effectively bend forwards. It might be that the back pain there is just a little bit too much, but we need to get some stretch through those hamstrings. So these are two variations, and these are really staged variations. We've got the first one lying down. Now my leg's just up against the cabinet over there, the wardrobe. But you can use a door frame. You can put your leg through the doorway. But find a position. There will be somewhere in your house where you can do this. The only challenge with this one, which is worth noting, is that actually the process of getting down on the floor might be a little bit difficult. Now, why are we doing it like this? This is really important though, because this, in some respects, I think is actually a lot easier to really relax into. And if we're trying to make an objective lengthening in these hamstring muscles, and we're doing a longer hold, maybe we're doing it for 3, 4, 5 minutes at a time. Two things to note. Number one, this position is an awful lot easier to maintain that stretch for because you're lying down and off weight bearing. So there's that extra benefit. To note that you will get numbness in your feet. The blood just drains from your legs. It would happen even if you had both legs up against the wall. So don't worry about that. That's normal. Feeling will come back into your little toes after you've finished. So that's okay. But the reason this is a great one is because the problem with doing sort of the classic one, even if you bend down and touch your toes, I haven't even covered on that one because it's just so bad and not good, especially if you've got back pain. But when you're in this position here, the tendency is as we stretch the hamstrings to pull the spine up and flatten the arch in the lower back. But if we have one leg that's flat whilst the other one is coming up in that position there, you're going to find that actually that flat leg resists the tendency for the movement to translate into your lower back, making the stretch more effective. And you'll again notice in the picture on the one side, I've got my hand on the knee. And a way to enhance the stretch here is to just slightly press down on that knee, just above the knee, sorry, to slightly straighten the leg a little bit more. It's not dead straight, but slightly straighten it, and that will help intensify the stretch. And slowly, as you go through this over the course of 2 or 3 minutes, you'll find that you can move a little bit closer to the wall. Bend the knee again a little bit, straighten it out a little bit, move closer to the wall, and so on, and just creep close to the wall. And over the course of the session, the days and the weeks, you'll find that you can almost get your bum right against the wall, and then you know you're really getting a good stretch. Now, the final way of really enhancing this, and sometimes this is maybe even necessary a little bit sooner, is to use that famous rolled up towel again. So you notice that's in the right position. This is the same position. If you've seen any of our other YouTube lives or on the membership site, this is exactly the same position as we're doing for the lumbar disc stretch. And this really forces that movement to go through the hamstrings, not in a negative way, but it just focuses it. Maybe focus is a better word. So we've got the spine here, and we've got the towel is just under this position here. So it means that even if there's a hint of that happening, the flattening of the spine happening, the towel is going to stop that happening. So it really focuses the movement through the hamstring and the hip only, without any possibility of that movement translating into the lumbar spine. So it's a really, really good one to do. A little bit more difficult, if you will, to get into that position. But once you're there, it's really, really comfortable, and you'll find the stretch very, very easy to do. And you will notice a difference between doing it with and without the towel. The towel just makes it that little bit better. But please do not put the towel too low. If you put the towel too low and you put the towel sort of down here, that's going to really make it very bad for you. So don't do that. Please definitely don't do that. And again, you can do the same thing. You can slowly move towards the wall on this one. But the reason this is a better form of hamstring stretch, this, in my opinion, probably the best. The only downside is that you have to get up afterwards, so be careful with that with regards to your lower back if it is a bit more challenged at present, is that there's no load on your spine. the stretch is completely focused to the hamstring. You can't really get it in the lower back. So the spine is protected for that reason. The core should be engaged, and then there's a lordosis that's maintained. That natural lordosis, we talk about that numerous times, being so important for the muscular, the discal, and the general functioning of your lumbar spine. Having those muscles or that spine in a neutral position is really, really important, and it's so effortless to do in that last position. So I'd really encourage you, if you've got any hamstring tightness, or even if you've got any back pain in general, we're sat down a lot right now, and those hamstrings are going to pull you into that slouch position if they're tight as you really get comfy in your chair. Doing this little stretch is going to help make it more effortless when you're sat at your desk, to stay upright, to stay with good posture. Be fidgety anyway, because that always helps. But do this stretch, try it 30 to 60 seconds, do it a couple times a day. It'll really, really help you, whether or not you've got back pain. It'll help you avoid back pain if you don't have it, and it'll help be part of a really good regime if you do have a bit of back pain, to just ease some of the tension going up into that lumbar spine. So that's pretty much it for today in terms of what I've got to talk about. Now over to Lara. What questions do we have?
Awesome. Okay, so Karen has asked, I think you've pretty much answered it, but
okay,
would this stretch be helpful if you don't have back pain, if you're spending a lot of time sitting right now?
So everyone sat down. I mentioned this earlier with regards to the spine. Everyone sat down. They're slouching in a lot of cases, or if you've been watching these videos, maybe you're not slouching anymore. That would be really good. But if we are, even a little bit, there's hamstrings. The knees are bent, so the hamstrings are shortened anyway. So just doing this little stretch, it's good. We're not getting the proper stretch through our bodies right now because of the lifestyle that we're having to lead, and just a little bit of extra TLC is going to be useful for you. And look, we've got time, so that's no excuse.
If you're waking up with back pain in the morning, you're really struggling to get out of bed, would it be worthwhile your partner kind of helping you get into this position? Are you resting their leg on your leg on their shoulder?
Okay, so yes and no.
Okay.
First thing in the morning, so we've got the IDD spinal decompression table in the clinic, and that works really well for taking load off the spine. When you've been sleeping for long periods of time, you've got load coming off your spine, that's when you heal essentially. But one way of re-engaging the body after a long period, for example, on the decompression table or in bed, is to get a little wiggle or a shimmy, where we are lying on our back, and if you take a bird's eye view, and we just wiggle left and right. Just that little wiggle of your hips. I'll give you guys a little demo, just left and right, just a little one. Okay, that's really going to help just loosen off the spine and just get things moving again. Really, really much better than doing anything like lifting the leg up, because sometimes things haven't re-engaged properly when you've woken up. Everything's kind of loosened, relaxed off a little bit overnight, and you may be feeling stiff. There's other reasons for that, which I can get to in a moment. But that little wiggle just helps re-engage everything effectively. You wouldn't want to just yank the leg up, even if it's done gently, straight away. I do that wiggle for a few minutes, and it really helps patients when it comes to getting off the decompression. Me getting off the decompression, that wiggle as that first engagement is a really safe way. I wouldn't be doing the knee rock. I'm not a big fan of that one. It's twisting, it's too violent, it's too much movement first thing. But the wiggle, just slowly wiggling the bum left and right, and then bend the knee up one at a time, and then roll onto your side, pop yourself up. That would be better. I'd probably do the hamstring stretch a little bit later in the day, but for those of you where you are in a little bit more discomfort right now, that stretch for the hamstring, where you've got a partner to help be your wall, yes, is an absolutely essential way of doing it. A little tip for them, so that you can help them help you, is if they rest if you're led on the bed and the near side leg we're going to stretch, if they rest their ankle on your shoulder here and you can just hold it in place, then you can take a small squat and then you can just stand up straight, and that allows it more effortlessly, so you don't end up with back pain trying to hold the leg like that. You can more effortlessly just sit there with their leg on your shoulder, and while they're relaxing into the stretch, you can have a chat, whatever else, while you're there. That works a lot better rather than do it first thing in the morning. Just that little shimmy left and right. You might do it for a few minutes to just re-engage everything, re-engage the spine. It's much better to do that first thing in the morning.
Left and right, not rotating.
You're not rotating, you are shifting like a shimmy. I'll demonstrate it again. Just left and right, not like that, okay? We don't want to do any of that. That's going to make you worse. That's not a good idea, or it runs the risk. It's all about risk. A lot of these things, same thing with the hamstring stretches that we've been through today. You want to stretch yourself in a way that's maximally effective with minimal chance of things messing up, and that's why I'd recommend that.
Okay, brilliant. Ollie has asked, can lower back pain come from the upper back? I've seen a lot of thoracic exercises. Just wondering if these are right to do.
So if well, a few things. One thing that commonly the overwhelming majority, and thinking of all the patients we've seen, the overwhelming majority when it comes to lower back pain is coming from down here. With reference to the thorax, the functioning of this joint here, what's called the lumbosacral spine or lumbosacral junction, is very, very similar to the thoracolumbar junction. So if there are stiffnesses and rigidities in the thoracic spine and this stops working, it can put extra stress and strain on the dampening functions of the L5S1. So doing exercises to improve mobility and strength and stability of this region would be helpful. But I wouldn't say there's not the same referral pattern that you get from the back into the leg as there is from the thorax into the mid-spine, other than the fact that mechanically they're related. So if there's rigidities in the thoracic spine, they can result in overcompensation being necessary in the lumbar spine, which can result in injury. It's normally the area that's working hard to compensate for stiffness elsewhere that becomes injured, rather than the stiff segment itself, because in order to become injured there needs to be a movement or a deformation of tissues, and that can't happen if nothing's moving. So it's generally the areas of hypermobility that become injured. So keep your thorax mobile, and keep your thorax strong and flexible. That's going to be helpful, but that would be the relationship between those two areas.
Okay, cool. And Joe has asked, how much do you have to feel the stretch? Do you have to stretch the muscle as far as possible?
Yeah, we're not trying to detach the muscle from the bone here. A lot of people really do go to town sometimes on the stretching, and it's almost like,
supposed to do?
Well, no, there needs to be a sensible approach. With regards to stretching, I don't know if you guys heard, but the question was, how hard should I be pulling? You should be feeling it in the belly of the muscle mostly. If you're starting to pull so hard you're getting discomfort in the attachment sites on the bone, then you really need to be careful of what you're doing. You need to listen to your body, feel your body, but actually sometimes we do get a certain group of patients where there's the desire to get better, and maybe the levels of pain aren't quite as high in this particular sector of the population, and maybe they're a little bit more active than other back pain sufferers, but they are hammering those muscles and just pulling them apart day in, day out. And I remember one young lady was awesome because she was stretching all the time, and we said, okay, we're going to do treatment and you're not allowed to stretch. Like, you're not allowed to stretch apart from when you come into the clinic, and we're going to do what we do here. And it literally is just like, this problem that's been plaguing my hip flexors for like 2-3 years or whatever it was just went. Yeah. And because there's that, it's a very, very capable, fit, active person, and was just overdoing it. So sometimes you do need to back off, and less is more. And that's another example of we have with that is with the decompression. Some people, when they get on the IDD table and they want to be pulled in half, and it's like, no. We just need to do what's necessary, or just need to do the level to get the movement through the muscle so it opens out. We don't need to pull everything in half and awesome. Break things. Yeah.
Great. In the presentation on your on the towel stretch, you said core needs to be engaged. Are you actively engaging your core while you're doing it?
To be completely honest, not sure why that was there.
Okay.
So I looked at that and I thought, well, the core needed to be engaged for the last one, but I prepared this morning, so I was looking at it thinking, the core, I mean, having your core engaged is not a problem. It would be doubly useful, if that makes sense. You're just practicing your core engagement exercise, which is fine. But yeah, truth be told, that was an error.
Okay.
It's awesome. Not the end of the world if you do engage your core, though, because that's not going to do any harm. It's not going to be beneficial, though, in any way.
Okay, brilliant. I think that's it. So YouTube, yeah. Okay,
any other questions?
No,
awesome.
That's it for today.
Well, I hope you guys found this video helpful and all the bits and pieces helpful. And if you're watching this later on in the day, after the fact, then if you've got any questions, please do post those in the comment section below. We do read those. We do try and add those questions to the list for the next day. So you're more than welcome. And we look forward to seeing you on the next live, which will be on tomorrow. I believe it's going to be at 1 p.m. again. So we'll see you there, and have a great afternoon. Thanks for watching, guys.